everyone, this is my audience Ashley, and we have Ava the bird watcher right here watching as well. For my presentation, I picked Herpes simplex virus, and I picked this because I knew that a bunch of people actually have it. They actually have HSV1, like myself, and pretty much all my roommates. We all have fever blisters, we get them all the time. So, bear with me because I have to bend down each time to change the slide. There are two types of microbes for HSV. There's HSV1 and HSV2. A gram stain cannot be applied to HSV, so it's neither gram negative or gram positive because it's a virus and not bacteria. So HSV is a sexually transmitted disease and it affects 1 in 6 people. So 1 out of the 6 people you know probably contains or has HSV. There are 8 or more types of HSV, but the most commonly known are HSV1 and HSV2. Currently, there's no cure for herpes, so it stays with you for a lifetime. HSV1 causes cold sores on your lips, around your lips, on your chin, on your face. Sometimes they're called cold sores, you can call them blisters, or you can just call them herpes. HSV2 causes genital herpes around the anus, the buttocks. You can get it on your thighs, you can get it pretty much anywhere down there. The herpes blisters are actually called lesions and they contain a fluid. Normally the herpes you get, they're going to be typically really small, but the more they grow and spread, they can get larger. Most of the time they're pretty painful and they tend to itch. Okay, so this is herpes, like this is HSV1 and there's a cold sore on their lip. And then this is HSV2 and this is on the vaginal area and it's kind of on her thighs as well and you can see that. They're pretty big blisters too. The signs and symptoms of HSV1, you get small, fluid, painful blisters around your lips or the edge of your mouth, on your chin as well, or it can be on your face like right here, or kind of on your nose. You'll have a fever, and a fever can actually cause the fever blisters you get. You'll get a sore throat, or you can get swollen lymph nodes in your neck. Most of the time before you get the fever blister, you'll feel a tingling sensation or it'll start to itch around your mouth or where you're going to get the cold sore. For HSV2, you're going to get a headache and you're going to have a hard time using the restroom. It's going to feel very painful. You'll get a fever and you should get muscle aches around your legs or area right here. In women, you'll have vaginal discharge. It'll most of the time be a different color or it'll just look really weird. You'll get swollen lymph glands in the groin, and you'll feel a tingling sensation in the genitalia, buttocks, and thighs. You'll get the small red blisters just like on HSV1, and they'll either be on your genitals or your inner thighs. In women, most of the time they're actually inside of their vagina, so that's why a ton of girls that have it don't know that they actually have it. And they can actually be painful, or they might not be painful at all, and you might not even know that you actually have them. For the initial exposure, in each case, the initial lesion is the same. During the first 2 weeks of contracting HSV, you'll get a pimple-like clear vesicle. It'll contain the infectious viral fluid. And to heal them, they'll need to be dried out from a cream or a pill. The blisters will heal within 7 to 10 days and they typically won't leave any scars. Once the dry crust falls off, the virus remains and spreads into the peripheral nerves and goes into the latency period. Exposure to stress, fever, and UV lights cause a secondary breakout that is much less severe than the first. For HSV, the causes of contracting it, you can get it from saliva, you can get it from kissing, from using the same utensils. This means cups, silverware, pretty much anything that touches someone that has HSV1. And sharing personal items like razors, if you cut yourself and then someone else uses it and they cut themselves, they have HSV. And receiving oral sex from someone who has HSV1, this can give you HSV. And also, if you give oral sex to someone and you only have HSV1, you can actually give them HSV2. And for HSV2, basically the only way that you can get it is have sexual contact with someone who has HSV2. And like I said, sometimes someone with HSV1 can actually give you genital herpes from oral sex. Oh, and 1 out of 3 people don't show symptoms for HSV1, and 2 out of 3 people don't show symptoms for HSV2. For the structure, it's a distinct four-layered structure, and it is composed of an envelope, a capsid, a tegument, and a genome. And it consists of a core that contains a large double-stranded DNA genome. And inside the genome, it is enclosed by an icosapentahedral capsid, which is composed of capsomers. And the capsid is surrounded by an amorphous protein coat called the tegument. The tegument is actually enclosed by a glycoprotein bearing lipid bilayer envelope. In this picture, you can actually see the structure of it. There's the glycoproteins, there's the capsid right here, the envelope's on the outside, and then there's the DNA, the double-stranded DNA in the middle, and then there's the tegument enclosing that. How does HSV work? How do you get it? So the virus works by replicating viral DNAs and releasing them. HSV can continuously flourish under favorable conditions. It contains a virulent protein that is called ICP34.5, and it works with many other cellular proteins to replicate HSV. It can turn off the autoimmune system, which actually can be really dangerous and pretty severe. It's very severe and harmful because it stays with one for an entire lifetime and can be transmitted multiple ways. Most people don't even know that they have HSV. You could have it and you wouldn't even know. It's not toxic or poisonous, but it's still considered one of the most difficult viruses to control. It won't kill the virus holder or cause them any serious health problems, but most people actually learn how to cope with it. They'll go to therapy, or they'll just talk to someone, and that can actually help. Sorry, y'all, the cat wants some attention. How it works, okay, this is the part 2 for that. Once the virus gets in contact with the mucous membrane, wound, or bloodstream, it begins to replicate. It then travels via the nerve cells to their roots where it becomes inactive. Since HSV is a latent infection, when one is first infected with the virus, the symptoms can be extremely intense for about a week or 2, but then the virus goes into hibernation. When the virus goes into hibernation, it resides in the carrier's nervous system at the base of their spine. For some people, HSV can permanently hibernate, so they won't have any symptoms for the rest of their life. But for other people, it actually will come up again and again, and the outbreaks will occur, but it won't be too bad. So, the people at risk for this are pretty much everyone. A woman is more known to be a carrier than a man, but this could be because they have a larger mucosal surface, and it's actually easier for a man to transmit it than a woman. 1 in 4 women have HSV, while 1 in 8 men have it. Prostitutes carry the highest rate of HSV at 80%, which it sounds about right. African Americans are more prone to contract HSV than Caucasians. More divorced people than married couples or singles carry HSV. Urbanites are more known to contract the virus than suburbanites. And the lower or the more poor the socioeconomic status, the higher the chance of getting infected by herpes. People who have a history of sexually transmitted disease, people who have started having sexual activity at a younger age, and people with a compromised immune system are at more and higher risk than others. How does HSV affect the population? Well, these are some pretty big numbers, so don't freak out. 3.7 billion people under the age of 50 have HSV1. This is approximately 67% of the population. Like I said, most people you probably know get herpes number 1, and more than 50 million people in the United States have HSV2, which is genital herpes. This means that 1 in 5 people have it. 25% of this number is female, while 20% of the number is male. 85% of the people with genital herpes don't even know they have it, so you have to always be careful. Treatment for HSV will never terminate the virus. It will never get rid of it. It'll always stick with you forever. It'll only help to stop the replication, and it will not work against the latent virus. The most common treatment is acliavir, which is also called Zovirax. This is the oldest and most commonly used to inhibit the activity of HSV1 and HSV2. Valacliavir or Valtrex and Famvir are also used as well. Valtrex works quicker than acliavir. For oral herpes, Dinavir is also used, but it is not approved for children. These medications can be prescribed in a topical form, and they can be used in a pill form. It doesn't matter. The topical treatment is just an ointment that can be spread all over the lesion. It'll help heal the herpes by drying them out, making them smaller, and help relieve pain and itch. All of these medications can be taken in 2 different ways. Episodic therapy implies taking the medication at the onset of the symptoms and continue to take it until the lesion disappears. And while most people with HSV are prescribed medicine, there are also over-the-counter topical treatments such as Abreva and Campho-Phenique. Those don't work as well, but they'll work for you if you don't know exactly what it is. Prevention. HSV-1. Avoid kissing people with visible cold sores. Do not share personal items with them if you see a cold sore. And wash your hands frequently. Anything they touch can pretty much give it to you. If you have HSV-1, be careful touching your eyes and genitals. Do not perform oral sex on your partner. This can give them HSV-1 or HSV-2. Just stay away. And use sunscreen because the sun can actually activate your HSV-1. And reduce your stress because stress can actually cause it. I know that. HSV-2. To avoid getting HSV-2, avoid having sex if you or your partner has an outbreak or active infection of herpes. Avoid touching the sores down there. As much as you probably want to touch them, do not touch them. It will just make them spread and grow larger. Use or have your partner use a latex condom even if the sores aren't visible. This will pretty much prevent it. Limit the number of sexual partners if you know that you have HSV-2. You don't need to go around spreading it to everyone. So, use a water-based lubricant to prevent friction during sex. This can actually irritate the skin and increase the risk of outbreaks. Currently, there are vaccines against herpes simplex virus 2. They're actually undergoing extensive evaluations in field trials. Therefore, as of right now, there are no vaccines that actually prevent herpes. That is the end. Thank you for watching.